Well, hi, I'm Jay Arthur, author of Lean Six Sigma for Hospitals and QI Macros. There's been a lot of anxiety about vaccine development. Like, oh, they're shortcutting it. No. Okay, if you know anything about Lean, you know that the original process was they did phase 1 trials. Then they evaluated the phase 1 trial. And then they set up a phase 2 trial, right? So the phase 2 trial, and then they would evaluate all of that, and then they would say, well, was that okay? And then they'd set up a phase 3 trial. So there's a whole bunch of delay built into the process. And then, and only after the phase 3 trial where they evaluated and made sure it was safe and effective, did they actually go into production. That's not what's happening. Most everybody now, there's a lot of vaccines in development. I'm sure one's going to come out as clear winner, and we'll see. I have no idea who that's going to be, right? But they did phase 1 trials, but while they were doing phase 1 trials, they were planning phase 2 trials so that when this one worked out, phase 2 trial could just be ramped right up. While they're doing phase 2 trials, they're planning phase 3 trials. And while they're doing phase 3 trials, guess what? If it made it to a phase 3 trial, the federal government is paying them to start producing hundreds of millions of doses, right? So in case this comes out the back end and is ready, they will have it produced and be ready to go. So this has collapsed the vaccine development curve because there's no more wait time. There's no wait between first phase and second phase and third phase and production and all this other stuff. No. Right? We're doing bang, 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 bang. And on the third phase, we're actually starting to produce hundreds of millions of doses so that we can start to vaccinate people safely and effectively. So if you're having high anxiety about the vaccine thing, I don't think you understand Lean and what is possible. So that's what we're doing. Trying to make a hassle-free America, hassle-free healthcare, a hassle-free society, all right? And that's my improvement insight for this week. Let's go out and improve something.